This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
We're getting a lot of live questions today, Prof. This is from Carol, which investigations are needed to be tested out for the wife?
For the wife?
Yeah, I'm assuming she's saying for the female partner, what investigations do you need to do?
Okay, investigations to some extent follow a detailed history. So I'd be getting history from the patient first to work out where I would be heading with investigations. But the basic investigations of a woman are two. One is to prove that you're ovulating, and we could do that with a blood test 7 days before your next period, which in a 28-day cycle is day 21 of the cycle. If you have a 35-day regular cycle, then that blood test should be done 7 days later on day 28. So it depends on your cycle. If you have irregular cycles, then you might do it on 2 or 3 occasions to check that the ovulation is occurring. The second, obviously, to get pregnant, you need the sperm and the egg to get together, and the only way they can get together is down the fallopian tube, and so we test whether the tubes are open. The standard test these days is called a HICOSI, which is an ultrasound test where the doctor inserts a tube into the neck of the womb, it's a little bit like having a pap smear. The speculum's put in, then the tube's put in through the neck of the womb, and then the bubbly fluid is pushed through the neck of the womb, into the uterine cavity, and on ultrasound they can see the bubbles disappearing out into the abdominal cavity, and that tells us that the tubes are fine. If there was any doubt about that test, we'd probably end up doing a laparoscopy, a keyhole surgery, to actually look and define why it wasn't normal. So they're the two big things. Generally, at that first visit, we also do a screen for infections, and we also generally do a chromosome test to check that the woman's got normal chromosomes. It's rare that an infertile patient has a problem with chromosomes, but it's obviously a major hurdle if we go through IVF and we don't know that's the case. It happens in about 1 in 150 cases that we find a chromosome abnormality in an infertile couple. So they're the basic investigations for sure.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.